This episode of The Matt Ferret Show is brought to you by the Brickhouse Agency. Brickhouse is a boutique independent health insurance agency that focuses on finding the right Medicare coverage for folks across the country. Matt's wife, Nikki, is the heart behind Brickhouse. She's great at making confusing things clear and is passionate about helping people find a Medicare insurance policy that suits their individual needs. To schedule a free one-on-one appointment with Nikki or a member of her team, head on over to brickhouseagency.com or simply call 844-844-6565 and someone will help you schedule a phone call or a Zoom meeting. The consultation is free because the insurance companies pay Brickhouse, not you. There's never any pressure or obligation to enroll. Your clearer, simpler Medicare journey is just a call or click away. BrickhouseAgency.com. Not affiliated with or endorsed by the government or federal Medicare program. Contacting Brickhouse Agency, LLC will direct you to a licensed insurance agent.
Hello everyone, this is Matt Ferret, author of Prepare for Medicare and Prepare for Social Security Insiders Guidebooks and online course training series. Welcome to another episode of The Matt Ferret Show, where I interview insiders and experts to help light a path to successful living in midlife, retirement, and beyond. Steve, welcome to the show.
Thank you for having me, Matt.
I'm glad you're here. So tell everybody what you do, how long you've been doing it, and how you help people.
Okay. Well, I'm an ENT surgeon or an otolaryngologist. That's the long term. I'm also a sleep medicine doctor. I've been doing this for over 20 years. And my passion and mission is to help people breathe better. And that's basically my field in ENT, to help people breathe better. And then if you can breathe better, then you can sleep better. And as a result of that, you have a much more fulfilling and healthy and fulfilling life.
That's a very unique calling, but also a very helpful one. So give me a sense of how many people have problems with breathing and structural problems with breathing in I don't know, in a population in the United States. Are we talking 1%, 10% here? How many people?
Well, I can argue that 100% have at least some degree of breathing at least one point in their lives. For example, if you have a cold or allergy attack, right? But what I deal with most is on the spectrum of breathing disorders. Way up here is something called sleep apnea. We'll get into that a little bit later. But my focus is actually what happens here before you get into sleep apnea. And so my basic premise, which I read about in my book, Sleep Interrupted, is that most modern humans have crowding of the airways because their jaws are getting smaller and smaller. And this is why everyone needs braces now. Have you noticed these younger people these days have these triangular faces, these long, narrow, tall faces?
No, I haven't, but now I'm going to start looking.
Now that I mentioned that, you're going to notice it.
I know, everywhere.
Yeah. But if you look at these pictures from 1930s or 40s, even in the 70s, people had much wider jaws and faces. And even 100 years ago, people didn't need their wisdom teeth taken out because they had that much more space. So there's a lot of different reasons why this is happening. But as a result of that, our airways are getting smaller and smaller. And so it's more difficult for us to breathe at night, and also affects your nasal cavity too. So that's the basic premise of my concept that I write about in my book. But this can lead to we can talk about any health condition, but as a result of this, as you get older, obviously, it's going to cause more problems, breathing and sleeping, and it's going to lead to other health problems.
Okay, the historian in me, or at least the anthropologist in me, wants to go, okay, wait a minute. Yeah.
Great.
I'm neither, but that whatever, amateurism I have in either one of those categories makes me go, wait a minute, people's faces are changing over time? Their heads are changing? Can you talk, how is this happening, or why is this happening?
Yeah, so traditionally, before we had modern processed foods, you had to physically chew and rip, grind and cut. And basically, with modern technology, our food got softer and softer. So we had processed foods, and the meats got cut up and made us softer for us to eat and easier to eat. But in the old days, you really had to work to eat. You had to chew a lot, right? And we didn't have modern technology to cook all our foods really soft and tender. And so when we moved away from eating lots of plants and vegetables and roots and meats and whatever to really work our jaws to soft processed foods with no nutritional value, with also added sugar and all the other toxic chemicals. As a result of that, we're just not working your jaws. And if you don't work your jaws, your face doesn't grow.
Never thought of it that way. So are we talking an evolutionary trait that's quickly happening, or are we just talking about muscle and then bone composition?
I wouldn't say it's evolution. It's devolution, actually, in the past 100 years or so. Actually, there was an interesting book by B. Wilson. It's called Consider the Fork. And it's a really fascinating book. She actually looked at modern cooking technology over the centuries. And there's one chapter about, I think this anthropologist, or I don't know if he's a dentist or not, but he studied he studied ancient skulls in England and China around the time that they developed cutlery. So they had metal technology to be able to create knives that were much cheaper to make and much easier to make, right? But only the rich people had access to knives. And so once they started using knives to cut their meats, they started to get dental crowding. And so even 200 years ago, people had what are called edge bites. So the front teeth, the bottom teeth kind of met like this. But modern humans have their jaws, the lower jaw gets pushed forward. So you have this overbite. So now everyone has an overbite. But what they found is that rich people had the overbite first, and then the peasants had the overbite last.
I can't be the only one that's putting his teeth together listening to this. I guess I have an overbite. Doesn't every human have an overbite?
Everyone does, yeah. Because if you have edge bites, that's considered abnormal these days.
But when orthodontia wasn't available, it was just you got the teeth that you got, and that was
right. Like but back then, you didn't really need orthodontics that much. For example, there's a classic book by Dr. Weston Price. He's the dentist that traveled the world in the 1920s to 40s. And he and his wife looked at indigenous cultures throughout all the different continents. And what he found across the board was that as long as you ate naturally off the land, you had perfectly aligned teeth, no cavities, and they're healthy.
Wild. Okay, so we've got, you said, is the word devolution? That's not devolution. It's de-evolution?
Well, I made up that word, devolution.
one of the two, but going the other way. So, okay, so so you're saying in modern society, you've got processed foods, easier to chew, not hard on the jaw. So I'm imagining, not only the muscles not being worked as they were 100 plus 1,000 and 10,000 years ago. But I guess the bone structure of the jaw is probably impacted. Haha, no pun intended for my dentist friends. The bone structure and the bone strength and the bone size, along with the muscle, that's also impacted, I would imagine.
Right, absolutely. And so there's less space for you to breathe through. And then if you gain weight, it's going to get worse because not only you gain weight on the outside, you gain weight on the inside. It narrows the airway. But there's a couple other factors. Like I said, it's multifactorial, not just about the chewing, but with modern infant feeding methods. So there's less breastfeeding and more bottle feeding. So they found that an infant suckling on the mother's breast, the mechanism to swallow is very different than sucking on the bottle nipple. Because when you're sucking on the mother's breast, the mother's nipple conforms to the mouth of the infant, whereas with the bottle nipple, your jaws and your teeth conform to the artificial bottle, which is harder. So bottle feeding is a risk factor for crooked teeth. That's been documented in dentistry. Also, nasal congestion. If you breathe through your mouth, your face gets long. And I can also add lots of different toxins that are in our environment that prevents your face from growing properly.
This is fascinating. I've never run across this in anything that I've ever read. So the way we're now feeding our kids is impacting their facial structure for life.
Yes.
Wow. I had no idea. It makes sense. I just had never, I mean, you probably don't run into it. Maybe you're looking for it, but I've never even read anything like this before. It's amazing.
Well, but if you look at it, you're going to find it. It's been around for decades.
Yeah. I'm going to go look for it now. So we've got narrower, gosh, that's hard to say, narrower jaws. and therefore crooked teeth, and then people go get their teeth fixed especially in the United States with orthodontia. And then wisdom teeth come in age 19, 20, 21, somewhere in there, and most people get them taken out.
Right.
And you're saying that, okay, so let's say I'm 20, I've been breastfed, bottle fed, I've eaten modern food, I'm 20 years old, spitting image of health, I'm young, I'm vibrant. What happens over the next decades?
Well, it depends on where you are on the spectrum. So, like I said, most modern people eventually need some or all of their wisdom teeth taken out. But in the old days, maybe even 10, 20 years ago, with modern orthodontics, what they used to do is to take out an additional 4 bicuspids. So you can imagine some people need 8 teeth removed, 4 wisdom teeth and 4 bicuspids, right? So you have perfectly aligned teeth, but your mouth is tiny. And these people have major breathing problems and health problems. And these are the dentists that kind of had this revelation with these patients that they had these tiny mouths with perfectly aligned teeth, but they're really sick. And the doctors couldn't help them. So then they start to have this revelation that maybe we're doing the wrong thing. So there's this schism in dentistry and orthodontics about can you take out teeth, or is it too aggressively? Are we taking out too many teeth, for example? So now the general consensus is to widen the hard palate and the jaws as opposed to extracting. So if you widen the palate with palatal expanders, appliances, braces, there's so many different ways of doing it. We're kind of shifting towards that philosophy as opposed to extracting now.
Okay. I'm flashing back to my childhood. I wonder what happened. I had braces. I wonder what happened. I don't know if I got my palate expanded. I can't remember that. Okay, so then that's happened to the majority of us listening, probably some sort of braces.
Yep.
And let's go into the sleep problems that have to do with this. So what are they? What can they be? We've all heard of sleep apnea, for example, but what else?
Okay. Well, let's define sleep apnea. That is a very generic term, but the formal diagnosis is obstructive sleep apnea, meaning that when you're sleeping, you stop breathing because your throat closes off. And that typically happens especially if you're overweight. And you have the classic snoring middle-aged man that snores a lot. That's your typical sleep apnea patient. But we know that even young, thin women that don't snore can have severe sleep apnea. Because if you're not snoring, you're not breathing.
Okay, so what happens when one has obstructive sleep apnea? What's going on in their heads?
What happens is that because your muscles start to relax when you're sleeping, especially in REM sleep when you're dreaming, that's when your muscles relax the most. Especially if you're on your back. So if you add sleeping on your back in REM sleep when you're dreaming with a small mouth, then you'll be more prone to obstruction. The muscles kind of cave in your throat. So you stop breathing for a couple of seconds or even up to a minute or two. So that's called an apnea. Now, on a sleep test, if you found to have an obstruction that lasts for more than 10 seconds, then that's called an apnea. And hypopneas are just lesser versions of that, but it has to be 10 seconds or longer. So you have to meet certain criteria, let's say 5 or more apneas or hypopneas per hour to say that you have mild sleep apnea. And then if you go to over 20 or 30, that's severe sleep apnea. And as a result, you get low oxygen. So you're struggling to breathe for 90 seconds at a time, 20, 30 times an hour. And long-term, it causes a lot of medical problems. So high blood pressure, diabetes, heart disease, heart attack, stroke, cancer, dementia, arthritis, digestive issues, skin problems. I mean, it's endless.
Not to mention your body's not recharging. It's waking up every 90 seconds is basically the premise, right?
You're right. And your body is in a constant state of stress.
And is it just old middle-aged men? Or can this happen with children, with teens?
Yeah. Well, there's certain phases throughout life where it kind of peaks. So for example, children around 3 to 5, that's when they start to get large tonsils. And that's when they start to have lots of sleep apnea. So that's why a lot of kids get their tonsils taken out. But they've done studies showing that if you apply palatal expansion to kids that need tonsillectomy, you can avoid tonsillectomy.
How do I know if I've got sleep apnea? Just if I snore?
Well, that's a typical symptom, but basically it's how well you sleep at night and how you feel or function during the daytime. or if you have any other medical complications like diabetes, anxiety, heart disease, high blood pressure. Actually, one of the most common symptoms of a sleep breathing disorder is nighttime urination.
How so?
And you would think that as you get older, people say that that's what happens when you get older, right? For men, it's prostate issues. For women, it's a bladder issue. What happens is that every time you stop breathing, you stretch your heart because you throw your clothes off here and you're trying to breathe in against a closed throat. And you create this tremendous vacuum or negative pressure in your chest cavity. And as a result, the heart gets stretched. And the heart thinks that there's too much blood coming in. So it produces a hormone that goes to your kidneys called atrial natriuretic peptide, which makes you pee more than usual throughout the night. So typically, if you wake up once per night, it's going to be around 3 a.m. because that's the first long period of REM sleep. So you're making more urine throughout the night, and then you have one apnea during REM sleep, and you wake up and you think you have to go to the bathroom. And if you wake up multiple times, it's about 90 minutes apart, which is one sleep cycle.
So if I'm waking up once a night to go to the bathroom and it's around 3 a.m., it may not just be me getting older or my prostate. It may be sleep apnea.
Right. And it could be a prostate issue, but first and foremost, make sure the AZORI is not sleep apnea because that's an easier thing to treat. Plus, not only do you help the nighttime urination, you're also going to be healthier as a result of addressing your sleep apnea.
Okay. So let me ask this then. So will my partner know if I've got sleep apnea? Do I wake them up? Is it just, will they know?
Typically, yes. If you sleep with someone for a long time, you'll see them stopping breathing and gasping for air, and you get really scared about that, scared for their life. But snoring is a very common symptom, and not everyone who snores has sleep apnea, but most do. But they've even shown that snoring without sleep apnea increases your risk of stroke.
Huh. Gosh, I'm starting to rethink the way I sleep. Does everyone need a sleep test? Let me just answer that, because should we go at some point, kind of like a checkup?
Yeah, I joke that there should be like a national screening test for sleep apnea because there's such a high preponderance of it. And there's certain countries, like I think there's a study in one of the Scandinavian countries, more than 50% of middle-aged women had it. And they're not that overweight over there either. So the more overweight you are, the more likely that you're going to have sleep apnea. And unfortunately, in our country, there's such a high rate of obesity right now and overweight. So I would say the vast majority have some degree of it. And that's why we also have diabetes and high blood pressure and heart disease and everything else.
All comorbidities then.
Yeah, exactly.
Even just sometimes the foundation you're saying can be just sleep apnea that exacerbates the other pieces.
Right. It's like a vicious cycle. One aggravates the other, no matter what starts it.
So okay, how can I determine whether or not I've got sleep apnea or some other obstructive sleep disorder during the day while I'm awake? What will I feel? What will I not feel?
Poor energy, for example, poor concentration, memory issues, anxiety, overly anxious. What else? Yeah, just poor energy, lack of focus, memory problems. Just basically, you can't function that well like you used to.
Okay. And then are there hormonal changes that happen at midlife or older adulthood, or when you get up in your 70s or 80s that occur that can lead to sleep apnea or sleep disorders in general?
Well, one particular thing that happens in women that's very common is during menopause. Now, one of the hormones that women have is progesterone, and you have estrogen plus progesterone, but progesterone specifically has this property of being a respiratory stimulant. It actually helps you to breathe better and faster. It increases muscle tone in the tongue too. So during menopause, progesterone goes down, actually starting in your late 30s, early 40s. And then by the mid-50s, it goes down to nothing. But as progesterone drops, the tongue gets more relaxed and you start to have more breathing problems. So breathing issues it's one of the symptoms of menopause because you're not sleeping well.
So back to this. So if I'm feeling like that, or I've got a partner that feels like that, you're telling sleep study. That's what your recommendation is, at least for a diagnosis or at least to rule something out.
Yeah. Well, before you go see a sleep doctor for a sleep study or an ENT, try the conservative options first. So first of all, go through all the sleep hygiene checklists that you see online about sleep hygiene, going to bed regular time. But if you're overweight, even losing 5 or 10 pounds can make a big difference. And also sleep habits. So let me just give you 3 simple tips for everybody, and it's good for everyone's health in general. Number 1, don't eat or snack within 3 to 4 hours of bedtime. That is the single most important advice I give to all my patients. And the reason is, the more stomach juices you have in your stomach, every time you do stop breathing, even a little bit, it's going to come up. You're going to vacuum it up into your throat, which causes inflammation. So this gives you the classic throat reflux symptoms like throat clearing, coughing, hoarseness, lump in the throat, difficulty swallowing. But that also causes inflammation in your throat, causing more narrowing. And what they've also found is that when acid comes up into your throat, it's not just acid that's irritating, but you also have bile, food particles, bacteria, and enzymes like pepsin. And surprisingly, they found pepsin, which is your enzyme, in your middle ear, sinus cavities, and your lungs.
Wow. So make sure you're doing your sleep hygiene and going to bed every night and not eating 3 to 4 hours, you said? I think I knew that. Yeah. Something in my brain tells me that says it takes your body or your stomach to digest a meal 2 hours. Is that not right? Is it more like
2 hours is the bare minimum, but everyone's different. And people have different thresholds. And the older you get, the shorter that time becomes. The longer the time becomes. That's why elderly people have to eat much earlier. Otherwise, they don't sleep.
Okay. So what goes on during a sleep test if I get to that stage?
So it has to be ordered by any doctor, but typically it's going to be a sleep doctor or an ENT, depending on what kind of symptoms you have. So if you go for nasal congestion, they find that you snore, they'll order a sleep test. But most of the time these days, people for routine sleep apnea don't sleep in a sleep lab. They order home tests, which are much more convenient and simpler. They hold off on the in-lab sleep studies for more complicated cases, like if you had heart failure or some other like seizures or something like that. So the home test is really easy. It's just a nasal cannula, like an oxygen probe, finger probe for the oxygen, and a chest probe to measure breathing. So it measures how many times you stop breathing every hour.
I didn't know those existed. So you can just get your doctor to order it with home, and you slap it on, wake up in the morning, and give it back to your doctor.
Right. And there's very many different options. The standard ones have the nasal probe, finger probe, and the chest probe. There are even other ones that are using high technology. It's a finger probe with a wristwatch, and it measures sympathetic arousals. It's called the WatchPat, and it correlates highly with in-lab sleep studies. And then you have the more the consumer type options, like the finger probe that measures oxygen. It's not as good as a sleep study, but just looking at the oxygen levels at night will give you some indication as to how many times you stop breathing and how low your oxygen gets if it's severe.
Wow. What should your oxygen not dip below when you're sleeping?
Nothing below 90%. And oftentimes with severe sleep apnea, you see it dipping into the 60s or 50s even.
Oh, wow.
That's not compatible with life.
No, it doesn't sound very good. 50% of the oxygen.
The good news about sleep apnea is that when you stop breathing long enough, you'll wake up. And then you start breathing again.
Huh.
But then that causes other problems, right?
Yep. A lot of other problems. You said wait 3 times. I think I was counting right. You said it 3 times. So talk about, we all know, right? The average American is, what did I read the other day? It was 70% of all Americans are either overweight or obese.
Yeah.
So when you gain weight, it's obviously not just in your posterior or your belly, but it's in your face, as I'm looking at my face, which is not as thin as I'd like it. So you gain weight in your face, and I'm assuming that then you gain weight inside your face as well. What does the weight do to your facial structure and your sleeping and your the stuff in behind your mouth?
Well, you have fat cells in your throat and especially in your tongue. So the fat cells get bigger. So it narrows the airway. So when you're awake, it's okay because you have some muscle tone. But as your muscles relax, there's less. It gets sucked in easier. There's different areas where there are different areas in the throat that can cave in or collapse.
Okay. So I have fat around my throat, is what you're telling me.
Yes. Especially in your tongue.
Does my tongue get fatter if I'm fatter?
Yeah.
Physically, I have a fatter tongue if I'm overweight.
Yeah. They've actually seen it go away with MRIs after weight loss.
Your tongue gets smaller after weight loss?
Yes.
I'm sorry I'm laughing. I just never knew that. I'm going to start looking at my tongue now. And I have a lot of things to look up and look at after this interview. Thank you for that. So weight loss, you said even 10 pounds, or is it does it have to do with the BMI or ideal weight?
Yeah, so the whole BMI concept is a little bit flawed because obviously bodybuilders have very high BMIs, but they're healthy, right? They have no fat.
Mm-hmm. Right.
But it depends on your jaw structure. So the larger your jaw structure, the more give you have or room for, you can gain a lot more weight and not have any symptoms. But the smaller the weight you start out with, you don't have that much of a margin. But losing weight, they've actually shown that if you lose 10% of your body weight, I think your AHI, the severity of the sleep apnea goes down about 20 or 30%. So that's significant.
Wow. Yet another reason to not have that Friday evening pizza and then Saturday morning leftover pizza. Okay.
One thing about weight is that poor sleep promotes weight gain.
How's it do that?
Because it drives up your hunger hormones. And also, if you don't sleep, because you're sleep deprived, you're going to crave unhealthy, sugary, fatty, unhealthy foods.
Which makes you fatter. Gosh, Mother Nature is evil, isn't she? She doesn't say, "Oh, you're overweight. You should only, want to eat kale when you're overweight." Nope. Mother Nature says eat more sugar and salt. That's not really nice of her, is it?
Well, Mother Nature doesn't say it. It's the food industry.
We've done it to ourselves, right? Now we have all these wonderful options to satiate our deepest cravings, no matter the time.
Right.
All right. So sleep apnea, we've all seen and know, the big vacuum cleaner ends, that, the big machines next to there. And I've also then now seen commercials where some guy hits a button and you can't see it, must be embedded. So what are the surgical ways, I guess, or that's non-surgical. Maybe that is both. What are the non-surgical and the surgical ways of treating sleep apnea? Sure.
Well, we'll go through the continuum from conservative to more aggressive, but you mentioned the vacuum cleaner. It's interesting. The inventor of the CPAP machine, Dr. Cullen Sullivan, I think in the 70s, he's an Australian pulmonologist. What he did was he took a vacuum cleaner machine, the pump, reversed the pressure, and made this makeshift mask with a person with sleep apnea and cured sleep apnea. The patient was really, really severe sleep apnea, so he woke up like a young man. So that's how the CPAP machine.
So CPAP is literally a vacuum cleaner.
Yes, it's a reverse vacuum cleaner. Yeah.
Just not with that kind of suction, hopefully.
Right. Very, very small pressure, but it's become very advanced these days with the different algorithms and very comfortable masks. But that is the standard treatment option that most sleep doctors will recommend, especially if you have mild to moderate sleep apnea. Now, obviously, with any kind of intervention, not everyone's going to tolerate it or like it. For some people, it's a lifesaver. For some people, it makes things worse. And for some people, not many, but in about 10% of people, it actually causes you to gain weight. Not too many doctors know about that.
Why is that?
My theory is that even though it helps to get rid of the apneas, the severe episodes, so oxygen levels don't drop below 90%, because there's something on your face and pressing air, it causes this microarousals in your brain. So it causes more sleep fragmentation, and on a more microscopic level as opposed to the major apneas.
Oh, wild.
Yeah.
Okay, so there's the vacuum cleaner, and then what are the other ones?
So the other option that the dentist can help you with is something called a mandibular advancement device. These are dental mouth guards that move your lower jaw forward, so pull your tongue forward. And so these are generally better tolerated than CPAP. And in terms of effectiveness, they're pretty equal. People will tolerate the dental device more, but the CPAP machine works a little bit better, so it's a wash. And they both have their problems. With the CPAP machine, you have air in the stomach and air leak and waking you up. The dental devices can cause bite problems, TMJ problems. But you don't know if it's going to work until you use it. So basically, I have this rule of thirds with all these devices. In general, about 1/3 will love it, 1/3 will hate it, and 1/3 will be okay with it.
Is there something that you can surgically implant?
Yeah, well, that's like the absolute last resort.
Okay.
Traditionally, with surgery, for example, in kids, tonsillectomy, if you have huge tonsils, that does wonders. But then as you get older, the tonsil will shrink. And then once you become an adult, what happens is the soft palate becomes really floppy and redundant. So it vibrates when you snore. And then when the muscles relax, it just obstructs. And on top of that, the tongue base can obstruct in some people. And then there's some other areas like what's called the epiglottis, which is the top of the voice box. But there's different levels. But the palate and the tongue are the two major areas. So when I started doing this over 20 years ago, that's what I did. I did major surgery of the tongue and the soft palate, the tonsils, and also the epiglottis. Now, I don't do jaw surgery, but the oral surgeons do double jaw surgery called the maxillomandibular advancement, where they move the upper and lower jaw forward about this much. So that one has like a 95% cure rate. The soft tissue operations that I do, that's more in the 60 to 80% success rate. So these are bigger operations, but now about 10 years ago, this new technology came along called the Inspire procedure. Actually, I was involved in one of the early versions of a same device for a different company called Apnea. So I was one of the first surgeons in the Northeast to do this in an investigational setting. And so basically, it's a pacemaker that you implant. It's like about this thin, like a regular heart pacemaker. You implant it under the chest wall here. And then you make a little incision under your neck, and you find the nerve that goes to your tongue. So you connect the lead under the skin here. And basically, there's a sensor in your chest rib cage. So when it senses that you're breathing in, it pulses your tongue. And it feels like, you don't feel a shock. You just feel like you're moving your tongue forward, because these are the same level of stimulation that your brain sends to your tongue.
That's wild. Mm-hmm. Is it in production now? That's probably not the right phrase.
It's been around for about 10 years, and they've gotten very good at it. But not everyone's a good candidate for it. They're very strict criteria. So, for example, you can't be too overweight. Your BMI has to be under 32. You can't have more than, I think, 40% central apnea, where your brain doesn't send signals to your lungs to breathe. You have to have tried or failed CPAP. And also, you have to undergo what's called a drug-induced sleep endoscopy, where we put you under anesthesia to take a look at how the throat is collapsing. So there's 4 or 5 specific criteria that you have to meet. And some people, they like the idea of not having to use the device, but other people don't like the idea of having something implanted. So it's also a psychological issue too.
That's wild. Okay, so aside from that, I'll ask another maybe silly question, because I'm full of silly questions. What about those breathing strips that you see sometimes athletes wear?
Sure.
Does that work? Well,
that gets into the question of, do these nasal breathing options help just treat the sleep apnea or the snoring? Now, for the snoring, it may help, but in general, we know that when you do any kind of nasal surgery, so that's much more aggressive nasal procedures, in general, it doesn't cure sleep apnea. It may help with the snoring a little bit, and patients definitely feel better after nasal surgery. And maybe in 10% of people with mild sleep apnea, it does help treat the sleep apnea, but overall, it doesn't do very much. But the main reason why I recommend improving your nasal breathing to begin with is that it allows the other options to work much better, especially CPAP and the mouth guard. So, for example, there was a study looking at people who couldn't tolerate CPAP, who also had nasal congestion. And when you treat the nasal congestion with surgery, the CPAP usage went from 30 minutes to 5.5 hours. There's a big difference. Yeah. Because if you notice stuff, you can open your mouth, and when you open your mouth, you get a mouth leak, and you're going to take the mask off.
Yeah. And you probably still stay asleep and take your mask off.
Yeah, that too. But in general, you have the conservative options like decongesting your nose with allergy medications, nasal saline irrigation, allergy medications. intranasal steroid sprays, and then the breathe right strips to keep your nostrils from caving in. So you have a deviated septum that's crooked like this. The turbinates, these wings inside your nose that swell up due to inflammation and allergies. Lastly, the nostrils cave in. So those three things contribute to nasal congestion. So typically what I recommend to start with is to use breathe right strips, or they have these cones or these clips that go on the inside that work much better. There's about 20 different options online you can find. I use breathe rights every night because it helps me to sleep better. It's a simple thing to try. And then another option you can experiment with is mouth taping. Have you heard of that?
No.
So what you can do is they have these commercial options you can buy online. It tapes your lips together with a little hole here so you can breathe. The key is to keep your mouth closed so that if you open your mouth, what happens is the tongue moves back and you stop breathing more often. You think you get more air in when you open your mouth, but it's the reverse. Now, I modified that. Rather than doing this, I go vertically down the middle with a little 1-inch medical tape. And the purpose of this is to suspend your jaw closed a little bit easier so that your jaws don't open. Because if you tape your lips together, you can still open your jaws. And you're not going to choke or have any medical problems.
It's got to be a weird. I'm thinking of every horror movie I've ever seen, or kidnapping movie with duct tape across your mouth.
Yeah, but the 1-inch tape is down the middle, so you can breathe out through the corners. And like I said, worst case scenario, you're going to wake up, and if it's uncomfortable, you just take it off. Yeah.
Are there sleeping positions that you can choose? I mean, I say this. I had a guest on the podcast that was much more general in terms of sleep and mattresses and everything. And it was, I'll admit it again, that I start off every night on my belly. I've been doing it as long as I can remember, but invariably during the night, I'll switch off the belly. I can't fall asleep on my side. I can't fall asleep on my back, but I can fall asleep on my belly. And then I go to a side or another side and I flip and I flop, and I'm hardly ever wake up on my back. Should I be forcing myself, or should anyone be forcing themselves to sleep in a certain way if they think they have these issues? And does that even help?
That's a big loaded question. I guess the other way you can ask this question is, what is the best sleep position for you? And for you, it's your stomach. Okay, so whatever position that you prefer, stay there. Actually, when I was in practice, what I would see is once a month or so, I would see a middle-aged woman who comes in with, let's say, 6 weeks of sinus infections, headaches, fatigue, just poor sleep. And she's coming in for sinus problems, right? And I ask her just the general questions about her sleep. And I ask her, do you sleep on your back side or stomach? And she says, I sleep on my back. But looking at her anatomy, I don't believe her. So, because I know she sleeps on the stomach or her side. So I ask her, when you were younger, how'd you sleep? On my stomach. Well, when did that change? Oh, maybe about 6 or 7 weeks ago. Why? My dermatologist told me not to sleep on my stomach because it causes wrinkles.
Okay. Makes sense if you don't want wrinkles, I guess.
But the wrinkles are from the sheets. It's not from the sleep positioning. Now, I can argue that you can get more wrinkles because your sleep's going to go downhill.
Right. I was going to say, if you get no sleep, then your skin's going to go south.
Yeah. And you see this you see that advice from dermatologists all the time still.
So sleep in the way that you normally sleep.
Yeah.
Don't make any forced changes if your body isn't naturally doing that.
Right. However, if you get injured or undergo surgery, you're going to have problems. So imagine if you got a shoulder surgery and you can't sleep in your normal position, you're going to be in trouble. So I saw this, for example, one of the things I wrote about in my book, Sleep Interrupted, was during my surgical internship, I would see like all these people having heart attacks and codes around 3 to 5 a.m., like 3 or 4 in a row. It was crazy. And then when I started to study sleep, I realized that that's when you go into REM sleep, when you're dreaming. That's when your muscles relax the most. But these patients, let's say that you're normally a side or stomach sleeper all your life, you're in your 50s or 60s, you have a little bit of high blood pressure, diabetes, and you undergo abdominal surgery, and you can't sleep on your side or stomach anymore, and you force sleep on your back, right? And on top of that, you're given narcotics for pain, which suppresses your drive to breathe. So like a triple whammy. REM sleep, on your back, given narcotics. Of course, you're gonna stop breathing all of a sudden at 3 to 5 a.m. when you're in REM sleep.
And then the heart expands, tries to figure out if it's got too much blood. Is that what you were saying? Too much blood, too little blood?
It's a totally different issue.
Totally different thing. I'm trying to tie the two together, and it's not working, right?
Because all of a sudden you're having multiple apneas, because you never had this before, because you would always sleep on your side or stomach, but now you're forced to sleep on your back. Plus you're given narcotics, which relaxes your muscles even more, right? And then, and then you go into REM sleep when you're dreaming, when your muscles are most relaxed. So actually, they've shown that people who have sleep apnea have heart attacks more between 12 midnight and 6 a.m., whereas people without sleep apnea have heart attacks between 6 a.m. and noon.
Okay. I mean, this has got to be unnerving for most people that you tell, right? You got to lose a lot of weight. You got to get a sleep study. There's a high chance that because of the way you were fed as an infant, right? The foods that you've eaten your entire life, that your face looks different now than it would have 50 or even 100 years ago. What else can I do about this if I think if I'm getting bad sleep, or if I'm raising kids, or I've been sleeping the same way for 60 years?
Yeah, I realize it sounds like a doom and gloom situation, but basically what I do as an ENT surgeon is to try to avoid surgery. And I have this holistic approach. And so obviously if you're overweight, that's the first thing you have to address. And there's different ways. We're not going to get into that. That's a huge topic in itself.
Yeah, right.
But my focus is to help you sleep better, because if you sleep better, the weight will come off easier too. So we talked about not eating late. Maybe reposition your sleep position based on what your doctor told you or told you not to do. So kind of see how you were sleeping when you were younger. They even have these wedged pillows that for example, I can't sleep on my side either because my arms get numb. So there's a wedge mattress. There's a hole that's cut up in the middle. And you put your arm through that hole, and there's a pillow that goes over here.
That's my couch. I have my couch cushion. I do that when I'm taking a nap.
Yeah. Actually, my best sleep ever many years ago was, I don't know why, but somehow I had to sleep on my couch in the office. And I got the best sleep ever because my head was caught on the armrest and was like this. So basically, when your neck is like this, you stop breathing more often. So you want to be neutral or up like this a little bit. That's why these contour pillows work, because they give you more height here, and this part goes up like this. So that helps with snoring too.
And it keeps this is going to sound gross, but it keeps the fat in your throat from closing up.
Well, it's just that all the tissues, especially your tongue, because the base of the tongue is the biggest dilator of your airway, the strongest dilator. And so when you're sleeping, it gets relaxed. And again, when you go into REM sleep, it gets even more relaxed. And so that's why these mouth guards to move your jaw forward, that helps too. Now, one other thing you can do before you start thinking about medical treatment are tongue exercises. It's called myofunctional therapy. And there's different names for it and different variations of it, but it's been shown to help lower the severity of sleep apnea by 50% on average, which is big. And for children, it's 60%.
Huh. Tongue exercises.
Yes.
That's fun.
Yeah.
Okay. Let me do an age-based question. Okay. Let's say, again, you're 60s, 70s, 80s. I mean, I've always heard you sleep less and less, people going to bed way earlier, but then getting up at 4 a.m. Mm-hmm. And I've always heard or read that, it's hormonal, or it's just they don't need as much sleep. Is that true? Or are these sleep issues potentially that have just exacerbated, and now over time you're sleeping 5 hours a night, 6 hours a night?
So the textbook answer is yes, it is true. That's what you have to answer on the tests and board exams. My personal opinion is that it's not, because I've seen so many airways as people age, and if you take what I'm telling you to be true, that means as you age, it gets worse and worse. Now, another scary thing that I found was, if you look at the voice box, when you're first born, the voice box and the soft palate overlap, they touch. That's when you look inside the infant's mouth, you can actually see the top of the voice box. But as you develop, the voice box drops and it separates away. So you get this gap between the soft palate and the voice box. That's called the oropharynx. That's where the tonsil will sit on the side. But then the voice box keeps dropping. That's why in men, the voice gets deeper in adolescence. And it keeps dropping in men until about 21. And women, it stops dropping around 16 or so, right? So you think that, I was taught that the voice box stops dropping at 21 for men, but it actually drops another full vertebral body length upon the age until like 60 or 70. So it keeps dropping. So as the voice box keeps dropping, the airway gets more destabilized.
In just men, it keeps dropping.
Well, in women too, but not to the same degree as men. I'm sorry, in men, it's not to the same degree in women.
Yeah, so my voice is going to get lower as I age?
Well, it's very slight.
Slight.
Yeah. So, but that's a theoretical concept, which kind of, it's interesting, but it's not very practical.
Well, no, I can't change any of that, right? I can't. I can't reach in there and get it back up.
Yeah. So getting back to your other question,
yeah,
my feeling is that as you get older, these airway issues are going to be more and more common, and so of course you're going to wake up earlier than 3 to 4 a.m. because you stop breathing to go to the bathroom, and because you had this sudden jolt of waking up because you stop breathing, you get this sympathetic stress response. It's hard to go back to sleep. And then because of these sleep disruptions, a lot of older people also want to go to bed earlier and earlier. It's called advanced sleep phase syndrome because you haven't slept that well.
What's it called? Advanced
sleep phase syndrome.
Okay.
It's where your normal sleep clock gets advanced. You want to go to sleep earlier.
And what does that do to one's body when your normal bedtime in your 40s or 50s was 10:30, 11, but now you're in your 70s and it's 8:30? What does that do? Right. Is it as a result of something, or is that I don't know how to ask that. Is it because there's a problem that you're going to bed at 8:30 or 8 o'clock, or is it just that's because you're waking up at 4 a.m.?
Right. Because if you're waking up at 4 a.m., you're going to be tired and sleepy. So you want to go to bed earlier and earlier. What ends up happening is it disrupts your social life. You can't spend time with your loved ones or your family members in the prime time, 8 o'clock to 10 o'clock time period.
Right. Okay, so sorry, you're gonna have to say that again. So when you what is it again?
It's called advanced sleep phase syndrome.
Advanced sleep phase syndrome. And that is typically in older adults?
Right. Compared to teenagers, they have delayed sleep phase syndrome because they stay up too late. Their sleep clock is shifted later. Elderly people, they shifted more earlier.
And why does advanced sleep, I messed it up again. Advanced sleep stage syndrome, is that right?
Sleep phase.
Darn it.
Yeah. You have to have a different, easier name for this.
Yeah, maybe it's an acronym that needs 3 instead of 4. Why does that start?
Well, in sleep medicine, there's a lot of theories as to why that happens, and there's some genetic predispositions, but that's pretty rare. My feeling is, again, if you're not sleeping, if you stayed up for 3 nights in a row, if you're given a chance to sleep, you're going to fall asleep much earlier than usual, right? So if that's been happening for years, naturally you're going to want to go to bed earlier. But because once you go to bed, because you stop breathing about 5-6 hours later, you wake up earlier than usual. And so this is why elderly people tend to sleep. They need less sleep. So I wouldn't say they need less sleep, but they just can't sleep that long because they stop breathing a lot. So that's my personal theory. But
right.
But the textbooks say that older people need less sleep, but I don't think that's necessarily true.
Okay. And so for the folks that say, like, it doesn't matter when I go to bed, I wake up at 5 a.m. on the dot every morning when I'm older. You're saying that may be true, but it may be sleep issues that have been there for a long time, and they're just they're just changing as you get older.
Exactly. So the breathing issues are contributing to the sleep issues.
Interesting.
Yeah. Well, for example,
yeah, go ahead.
Yeah. Well, another just a little bit off topic, but it's kind of germane to what we're talking about. For example, insomnia, so when people have trouble sleeping. It's a huge problem in this country. And one of my colleagues, Dr. Barry Kreco, he actually looked at people who had what's called treatment-resistant complex insomnia, meaning that they've been suffering from insomnia, they couldn't fall asleep for hours or even stay up the whole night. They tried multiple medications, tried everything in the book, nothing worked. And what he did was he did sleep studies on all of them and found that about 2/3 had undiagnosed sleep apnea. And then then he did another study. He looked at insomniacs without any history of sleep apnea, and he gave them a CPAP machine versus a more complicated machine called an ASV machine. I won't get into the details, but basically, the more sophisticated CPAP machine, I think it cured the insomnia in about 3/4 of the patients, whereas with the CPAP machine, it cured it in about 40%. So just to go to show that people who have these traditional sleep symptoms like insomnia, waking up too early, or going to bed too late, a lot of it is connected to a sleep breathing problem.
Sleep breathing problem. And the person who goes to bed at a normal time, wakes up between 1 and 2, and then can't get back to sleep till 4 a.m. Is that classified as insomnia, or just waking up in the middle of the night?
Right. So if you go to a sleep doctor, that is considered a sleep maintenance insomnia. There's a sleep onset insomnia. You can't fall asleep when you want to. A sleep maintenance insomnia is you can't stay asleep. You keep waking up. But again, there's probably 20 or 30 different reasons for that. But the first thing you have to roll in and roll out is a breathing problem, because so many people have it.
Okay. Wow, this has been fascinating. Really, it has been. I think you've given me some homework to go do and poke around the internet and see what I can find, at least, on this stuff. Really, really interesting. And I'm going to be thinking about my fat tongue for a while.
Sorry for implanting that image into your mind.
No, I'm going to be... I don't think I'll be the only one, but if I lose weight... Well, how about this? When I lose weight, I'm going to look at my tongue and see if I can tell. Weird. Never knew that. Yeah. Thank you very much for being on the show. The last question I always ask, is there anything about sleep and breathing issues or sleep apnea or anything else related to sleep health that we didn't cover, or questions that I didn't ask that I should have?
Well, I'm going to bring up this topic because I'm working on a video that I'm doing right now. And it's a topic of cognitive impairment and dementia, memory problems. I'm sure that's a major problem for people in your audience.
Yeah.
And we know that poor sleep is a major risk factor for memory impairment and dementia. In fact, they've shown that people with untreated severe sleep apnea have much higher risk of this dementia and Alzheimer's. And when they treat those patients, it doesn't cure it, but it slows it down.
So people with current dementia diagnoses can benefit from sleep health.
Yeah, not all, but many. For example, there was one study that looked at brain imaging and people with severe sleep apnea, and they found that there were certain parts of the brain that were basically dead. Multiple areas in the brain, but then after 6 months of CPAP use, the brain areas start to regenerate partially. So, and their memory got better a little bit too. So not completely, but it got better.
Wow. So if someone's dealing with potential age-related dementia or just dementia diagnosis, including Alzheimer's, which is one of the many, many, many dementia-related diseases, look into sleep health. Ask your doctors.
Yeah, absolutely. I mean, even if you don't have it, at least you've checked it off the list. But I would say, I'm going to guess maybe 20, 30, even 50% of the time, it's a treatable condition.
Wow. Well, I knew that sleep was very, very important. But gosh, you've given me a whole bunch of other motivations to A, lose weight, and B, pay attention more to my partner and her sleep habits, and C, pay attention more to mine, because I certainly don't want to be in a position where I'm sleeping the way I'm sleeping and it's going to cause me damage later on in life. Thank you very much, Steve, for being on the show. This has been really fascinating.
It was my pleasure.
The Matt Ferret Show, related content, publications, and MF Media LLC is in no way associated, endorsed, or authorized by any governmental agency, including the Social Security Administration, the Department of Health and Human Services, or the Centers for Medicare and Medicaid Services. The Matt Ferret Show is in no way associated with, authorized, approved, endorsed, nor in any way affiliated with any company, trademark names, or other marks mentioned or referenced in or on The Matt Ferret Show. Any such mention is for purpose of reference only. Any advice, generalized statistics, or opinions expressed are strictly those of the host and guests of The Matt Ferret Show. Although every effort has been made to ensure the contents of The Matt Ferret Show and related content are correct and complete, laws and regulations change quickly and often. The ideas and opinions expressed on The Matt Ferret Show aren't meant to replace the sage advice of healthcare, insurance, financial planning, accounting, or legal professionals. You are responsible for your financial decisions. It is your sole responsibility to independently evaluate the accuracy, correctness, or completeness of the content, services, and products of, and associated with, The Matt Ferret Show, MF Media LLC, and any related content or publications. The thoughts and opinions expressed on The Matt Ferret Show are those of the host and The Matt Ferret Show guests only, and are not the thoughts and opinions of any current or former employer of the host or guests of The Matt Ferret Show, nor is The Matt Ferret Show made by, on behalf of, or endorsed or approved by any current or former employer of the host or guests of The Matt Ferret Show.